Elvis Presley, king of rock and roll. His music and attitude changed the world forever, but he was ruthlessly exploited by others to become a troubled, medication-addicted, bloated caricature of his former self, dying on the toilet, without dignity and alone. I'm Professor Graham Yorston, a neuropsychiatrist with over 30 years clinical experience, and in this video I'm going to be exploring the glorious but troubled life of Elvis Presley. I will be focusing on his final illness and death, critically evaluating the medical evidence to help you make up your own mind about what really killed Elvis Presley. He was born in 1935 in a two-room shotgun house built by his father in Tupelo, Mississippi, half an hour after his stillborn twin brother. He didn't have the easiest of childhoods. Both parents drank, and his father did jail time for altering a cheque. There was a strong family history of heart disease and depression. His grandmother Doll spent 12 years in bed, too morose to get up, and his mother died at the age of 46 from alcoholic cirrhosis of the liver. But he survived the poverty, and at the age of 10 he got his first guitar, and 2 years later, undeterred by being taunted at school as a white trash kid playing hillbilly music, he made his debut on a local radio station. The family moved to Memphis, Tennessee when he was 13, and he continued practicing and playing music and hanging around Beale Street, absorbing all the rich musical influences of a world that was still firmly segregated. After high school, he got a job as a truck driver, but he continued to play local gigs and try out for professional bands. He recorded an acetate disc at Sun Records and was invited back for a proper recording session. It didn't go particularly well, and everyone was preparing to pack up and go home, when he picked up his guitar and launched into an old blues number. Those who were there said he just started singing and jumping around and acting the fool. It was the sound that Sun Records boss Sam Phillips had been looking for. 3 days later it was played on the radio. A single and live performances followed, and the rest is history. Over the next year he appeared on radio and local TV, and had a fateful meeting with Colonel Tom Parker, an illegal Dutch immigrant and carnival worker turned music promoter. Parker gradually wheedled his way into being Presley's sole representative and taking an unprecedented 50% cut of his earnings. To say Parker is a controversial figure is an understatement. Nowhere have I read anything positive about him, and his malign influence must have had an impact on the well-being of the caring, kind and generous young Elvis. His first #1 hit, Heartbreak Hotel, came in 1956, along with TV appearances and screaming crowds, and intense disapproval from the conservative establishment who were terrified by his provocative stage persona. More hits followed, and even his 2-year military service in Germany didn't stop the records flying off the shelves. While in Germany, he was introduced to amphetamines by one of his sergeants to help him stay awake on guard duty. At the time, they were perfectly legal and widely used as stimulants. But the demon of drug addiction that started at this time would ultimately cost him his life. He also met Priscilla. She was 14 and he was 24. He was besotted. When he returned to the US, he had other dalliances, but Priscilla moved into Graceland in 1963, and they were married 4 years later. Elvis's career had been in the doldrums because of Colonel Parker's determination to focus on films rather than live performances, but after his legendary 1968 comeback concert, he started touring again. It reinvigorated his career, but had unhappy consequences for the marriage, as both had affairs. They were divorced in 1973, but by then his health was in serious decline. He overdosed on barbiturates twice that year, spending 3 days in a coma in his hotel suite after one of them. In September 1974, his keyboardist described how he arrived at a concert and fell out of his limousine onto his knees, and for the first 30 minutes on stage he had to hold onto the microphone like it was a post. His guitarist recalled, "He was all gut. He was slurring. It was obvious he was drugged. The words to the songs were barely intelligible. A journalist wrote that by early 1977, Presley had become a grotesque caricature of his sleek, energetic former self. Grossly overweight, his mind dulled by the pharmacopoeia he daily ingested, he was barely able to pull himself through his abbreviated concerts. Although he cancelled some shows, he somehow managed to stick to most of his touring commitments. His last performances, 2 months before he died, are painful to watch. He was still trying to please the crowds, despite clearly struggling both mentally and physically.
I gotta do this first. This is a song that I just recorded, and it's an old song called Unchained Melody. I had to play the piano, so it'll take just a second. I don't know all the chords, so if you hear me, get my fingers caught in the keys back here, you know what it is.
On August 16th, 1977, he was scheduled to fly off to begin another tour, but that afternoon his girlfriend discovered him on the bathroom floor, his body frozen in a seated position after falling off the toilet. He was taken to Baptist Memorial Hospital, where he was pronounced dead. He weighed 350 pounds, or 158 kilograms. An autopsy was undertaken the same day, but before it had even finished, and without the agreement of the other pathologists, Memphis medical examiner Jerry Francisco announced to the press that Presley had suffered a cardiac arrest and that drugs had played no part in his death. This was highly irregular. Toxicology screens take weeks to come back, so there was no way he could have ruled out drugs as a cause of death. Nobody was convinced, and allegations of a cover-up were rife. Presley's funeral was held 2 days later. 80,000 people lined the route to the cemetery, where he was buried next to his mother. When the toxicology screen came through, it showed 14 drugs in his system, 10 of which were in significant quantities, mostly sedatives and painkillers. Although it was only the codeine that was above the normal therapeutic level, barbiturates and benzodiazepines act at the same receptor in the brain, so their side effects and toxicity are greatly increased when several of them are taken together. Symptoms of barbiturate overdose include incoordination, slurred speech, and difficulty in thinking, all of which are clearly visible in those painful last concerts. In 1979, forensic pathologist Cyril Wecht reviewed the evidence and concluded that a combination of central nervous system depressants had resulted in Presley's accidental death. He was very vocal in his criticism of Jerry Francisco and the people around Elvis, who he felt were too invested in trying to preserve his reputation. One of those people was Dr. George Nikopoulos, known as Dr. Nick, Presley's primary care physician for 10 years, who prescribed him more than 10,000 doses of sedatives, amphetamines and narcotics in his final 8 months. That's 43 pills a day. Dr. Nick was given a temporary ban on prescribing medicine in 1980, and criminal charges followed, but he was found not guilty of criminal liability for Presley's death. He said he was always trying to get Elvis to reduce the amounts of drugs he was taking, but it was better for him to prescribe than for Elvis to get them elsewhere. A further investigation into Dr. Nick's practice in 1993, however, led to his license being permanently revoked after he admitted overprescribing for numerous patients for many years. In 1994, Presley's death was reviewed again by a county coroner, who concluded there is nothing in any of the data that supports a death from drugs. In fact, everything points to a sudden, violent heart attack. Really? Maybe he had a different set of documents, because otherwise this just doesn't make sense. So, are we any closer to finding out what actually killed Elvis? In his younger days, Elvis was physically fit, but his lifelong, high-fat, high-carb diet not only piled on the pounds, it also furred up his arteries, giving him high blood pressure and an enlarged heart. In October 1973, at the age of 38, he was rushed into hospital semi-conscious with jaundice, breathing difficulties, marked swelling of his face and a distended abdomen. A doctor had been treating his back pain with cortisone and Demerol or pethidine, a powerful opioid, so he had swelled up as if he had Cushing's disease. The medical team did their best to detoxify him from the pethidine and other drugs, but as soon as he was out of hospital, he just got more. He had 2 hospitalizations in 1975 with a massively distended colon, fatty liver and high blood pressure, and a further admission in April 1977, just a few months before the end. But why was he taking so many pills? Did nobody tell him what he was doing to himself? Dr. Forrest Tennant, a pain and addiction physician who testified as a defence witness at Dr. Nick's trial, has suggested that he had a rare connective tissue disorder called Ehlers-Danlos syndrome, or EDS, characterised by joint hyperflexibility and complex symptoms in many different organs, and a liver enzyme defect which meant he was unable to metabolize codeine. To explain Presley's headaches, slurred speech, and mental slowness, Dr. Tennant suggests that he developed traumatic encephalopathy after tripping and banging his head in 1967. I have to say, I don't find Dr. Tennant's arguments terribly convincing. Traumatic encephalopathy will be extremely unlikely after 1 or 2 minor head injuries, and suggesting that he had EDS just because of his hip swivelling seems a little far-fetched. Those close to Presley could see the drugs were killing him, even if his doctors could not. His former wife Priscilla has said that he knew what he was doing, and that she and others had tried time and again to get him off his drugs. Some family members have even suggested that he took his own life after failing to block the publication of the tell-all memoir by his former bodyguards just 2 weeks before his death. His friend and road manager Joe Esposito seemed to confirm this when he revealed that he had found a note beside Presley's body, saying that he was sick and tired of his life, and that losing Priscilla was the greatest mistake of his life, and that he couldn't recover from the heartache, that he was embarrassed that he couldn't kick drugs, and that he felt betrayed by his overweight body. What really killed Elvis Presley? We'll probably never know for sure, as there is so much conflicting information. It could have been an acute cardiac event brought on by straining on the toilet, or an overdose of medication, either deliberate or accidental. What is clear, though, is that his long-term addiction to prescribed medication had a major impact on his physical health, which contributed to his untimely end. Thank you for watching. Please like and subscribe, and keep the comments and suggestions for new topics coming in. See you next time.